Professor Tango, welcome to the show. How are you?
Oh, I'm doing fine, my brother. We thank God.
Hallelujah.
It's been some time.
It has been such a long time since we saw each other.
Yeah, it has been, I think, a couple of years, perhaps. But
yeah.
How is technology?
How is Kazakhstan?
Kazakhstan is fine. We are doing great to the
right.
Yeah.
Wow. I see you are next to Russia and China.
Sure.
All right. Wow. How many years have you been there by now?
I've been here almost 2.5 years.
All right.
Yeah, 2 years or 5 months now.
Wow.
Yeah.
Awesome stuff. Awesome stuff. So thank you so much for coming. We are very glad, and I'm sure I'm going to benefit and the audience is going to benefit as well.
Thank you very much. It's my pleasure.
Yes. So to start with, I know you have a fantastic story to tell. So I thought we need to start by hearing your story. Who is Matthew N.Tanko? What are some of the things that have happened in your life? What have you done? How have you become who you are? Before we start talking leadership and health issues and all these things, please feel free.
Okay, thank you very much. Well, where do I start now? Anyway, as you probably know a few things about me, when we were still together in Botswana.
Yes.
Let me say that my life started in Nigeria. I'm actually Nigerian, and I was born and raised in Nigeria and had most of my training, schooling and training in Nigeria. So I trained to be a medical doctor. I became one in the Nigerian health system and a training system, becoming a specialist right in Nigeria before I left Nigeria. And what I think, well, a few things about me is that I grew up to, to love to just serve people, to see the better part of people, to see life getting better for people. And I guess perhaps that's what influenced also my choice of a career as a medical doctor. And so that was something that was a passion for me. And the second thing about my life is that right early in my life, I think I got so much in love with God. And as early as the age of 9 or 10, if I remember, I think I was already carrying Bibles and going around with my parents and other people preaching the gospel. And
that's amazing.
So that shaped a lot of my thoughts and a lot of my life. And so even during my schooling life, it wasn't just academics. I was both fellowship leaders, in schools and so on. So that's what happened, and that was shaped my life until I left Nigeria some 16 years ago, having practiced in Nigeria for a few years. I taught in the medical school in the University of Jos, and also practiced as a consultant at the Jos University Teaching Hospital. And then I was selected by the government of Nigeria, and I was sent to Uganda. I was deployed to Uganda on nation-to-nation cooperation. So I was in Uganda for 2 years, 4 months. In Uganda, I continued the same way as, preaching the gospel and also doing my work. I was appointed to start a department, and subsequently again appointed to start a faculty of clinical sciences as the first dean in that medical school. So I did that, and after that period, I was then recruited by the Botswana government when the government wanted to start a medical school in Botswana. So I was privileged to be one of the very few and first faculty members to be recruited and to start the medical school in Botswana. So again, I was appointed to head a department, and we started developing the medical school. And again, continue serving God, continue working hard, continue delivering my best. After a couple of years, I was again elevated to be to the deanship position of the medical school in Botswana until I left to this place. So altogether, I was in Botswana for close to 9 years, and before I left in 2017 and coming here to Kazakhstan.
And I am glad that I was a witness to see the great work that you did for the land of Botswana.
Great. Thank you very much. Thank God for the grace.
Yeah.
So that's all about me. I'm married. I have 4 kids, beautiful kids here. We're doing well. And here in Kazakhstan, again, we are trying to build up structures for the health system, the medical school and the health system. And at the moment, I'm privileged again to head a clinical academic department and as a professor in that medical school.
Wow. Thank you so much, Prof. And one thing that is in common between you and me is our passion to serve people, the love for people, and the love for God.
Sure.
I don't think it's very easy to love people without loving the God who made the people.
I think it's impossible. As you know, that even Jesus says you cannot say that you love him, claim to love him, if you do not love your neighbor.
That's very true. That's very true. So the reason why I decided to invite you is because of my passion to empower and inspire entrepreneurs and business leaders with knowledge and skills, which helps them to succeed and create jobs, reduce poverty, and contribute to economic development of the nation of Botswana and to Africa and to the rest of the world. That is what I do, and I'm very glad to have you on the show today. Now, having given us your story, I would like us to now delve into what is your thought on the current challenges in the health sector globally?
Well, thank you very much. Let me start by saying that, it is no longer news that the entire health sector of the world, is in complete disarray, to say the least.
Yes.
A simple reason being that even countries that are supposedly having the most developed health sector, are not coping. And the so-called robust health system have been completely, sort of rendered inefficient, and is a matter of, it's like a rat race, so to say. I think that we are not expecting this pandemic, at least on this scale. So it is a great challenge to the health sector of the world, in all countries actually. And some of the challenges that you can easily see is, one is the challenge of access. Now, what is happening is, because of the scale of the pandemic, access to essential medical services, access to even social services, access to critical life-saving equipment, is completely, impeded. And so what is happening, and at the peak of this pandemic in some countries, in fact, it was a matter of who lives and who dies because of the critical shortage of medical services to sustain the patients that are being affected by this virus. So access is a problem. One of the major things in terms of access is, particularly in our setting in developing countries and in Africa, we depend on importing medical, medical drugs, medical services, medical equipment, and so on. And you can see that, transportation and deliveries and chain supplies have all been disrupted by this global pandemic. What it then means is our dependence on the supplies of these critical services from abroad is no longer the way they should be. And I think that our prayers to God is that we don't go beyond the current level in Africa, because in most of our systems, our health systems are very fragile. We are very unprepared to cope with anything like this. And if it does hit Africa hard rather, it's going to be a global, it's going to be a serious problem for the continent. And we just hope that it doesn't go beyond what it is now. Manufacturing industries for medical equipment, medical services, all these things are also stretched. They cannot cope with the demand. You cannot ask for 100,000 ventilators when you have hundreds of people that are living between life and death, and you want 100,000 ventilators, manufactured for you over a short time. So every angle is affected. It's a vicious cycle. And we must try to look at it in a very holistic way. And really, we need leadership thinking, at this moment to be able to help our societies get out of this pandemic, God helping us. Now, the other great challenge is that of safety. At least in the history of, as far as I remember, very few pandemics have posed risk to health workers like this pandemic of the coronavirus. Medical doctors and nurses and other health workers at the forefront of battling this pandemic are risking their lives at the highest level. And as you must have read, that in some countries, for example, scores of medical doctors and health workers have come down with this disease and have died.
Yes, very sadly so.
So you can see now what is it doing to our capacity? It is reducing the manpower capacity, of the healthcare providers that should be rendering services to the health system. Again, going into a vicious cycle. The second level of risk is the people who are being affected, the health workers that are being affected by this pandemic, even their family members are at risk of getting infected. And you can see that it's a big challenge for us here. And we can only, do so much and trust God for the rest. I've talked about supply chain logistics. It's another big challenge. And it's not only, for example, this is not only for developing country or developing world. It's a global challenge. Even the most robust economies and so on are not coping, So it's a big problem. Medical drugs, by the way, not only for coronavirus disease, even because the other diseases have not gone on holiday, as you know. They are also there, but now everybody has turned attention on coronavirus and the logistics challenge of supplies, even of other drugs and other medical services and other medical, essential medical equipment for other diseases are being affected as well. So it is a multi-pronged challenge that is affecting our health sector, all around. And what's going to happen is the most vulnerable economies, like some of our developing countries in Africa, will seriously be worst hit if this pandemic escalates beyond what we have now. And that's why we must actually trust God and pray. At least in Africa, where I believe we're a praying continent, and if there's any time that we need to pray more, it should be now, and really pray, and I mean to turn to God really in sincerity and in being serious with God. The other aspect of the challenge is financial stress. Now, the whole of the world economy is under severe stress now. I mean, you know, I was reading something during the peak of this pandemic in Italy, and I saw the Italian Prime Minister, you know, I mean, crying.
Yeah.
Saying we have lost it. And you hear statements like that from world leaders. That tells you the degree to which this pandemic has affected our system and our global economy. So it's a serious one. The pandemic has crippled virtually most of the economic activities. If you look at the market in the world, the stock market, you know, everything that was very bright before seems to have either stagnated or gone down. It's not the end of the tunnel, but I mean, it's not the end of life. We believe that we can rebuild economy if we have the right strategies and right leadership thinking. So this is what is happening. And every aspect of human life is actually affected by this global pandemic, not only health sector, as you can see. So that's where we are, and these are some of the main challenges that you can see that is common across all the nations of the world that are affected by this global pandemic.
Thank you very much, Prof. Thank you so much. Highly appreciated. We are in trying times indeed. Now, my belief is, as you are saying, that we need strategic thinking and we need, you know, solutions. And I think entrepreneurs are some of the people that can solve some of these problems. I know many people like taking it political, but I don't believe in mixing business with politics. So I always want to stay on the business side of things and say, as entrepreneurs, since already you have told us about the supply chain, you know, the logistics, everything the demand is just too much. What do you think are some of the opportunities that arise, in particular, I don't know whether we can say in the health sector or in all sectors because of this pandemic?
Yeah, well, you know, if we, like we said, we need strategic thinking, and even for entrepreneurs and for everybody right now that is in some position of leadership, business, health, anything. Within this challenge, there are still opportunities.
Right.
And that is where we need to look at it carefully. Now, there are areas that we can easily identify gaps, you know, in trying to meet this global demand and solve some of the problems of this global challenge. We've talked about the supply chain. We've talked about, you know, the disruption of the economic cycles and so on. Now, in our own localities, let me start from small scale level. In our own localities, what we should begin to do is to think of what can I do as an entrepreneur in order to fill in a gap that has to do with, let's say, the supply chain disruption, or how can I, you know, how can I collaborate, you know, not necessarily physical collaboration, because now I'm talking to you, I didn't have to travel to Botswana, but business is still going on, as you know. So we need to put our minds together and begin to think. Maybe we are still in a rat race in the middle of the fire and so on and so forth. So we need to think fast, but we also need to start laying the foundation for our strategic thinking moving forward when we are faced with similar challenges. This is the time to begin to lay the building blocks of thinking of how we can face this. So if, for example, as a small, you know, business person or someone that I want to do something, one of the main things to think of is where you can fill the gap. Can I get to connect with someone who knows how to get something across to where we are or across to my place, and then I can supply such things, you know, whether it is digitally or whether whatever means that is possible. So we have to think out of the box and see, identify the gaps. They are clear, there are gaps clearly. We don't have to go on the international scale. We have to start where we are because the problems affect everybody. One of the other things I can tell you is that the lockdown has brought so many hunger to people, so much hunger to people, and this was not prepared for. And I'm going to talk about that later on in the discussion. You know, for as entrepreneurs, you always have to think of how to get this across to people. What is happening in our place here? People who can move, who are allowed to move, have developed extra, you know, thoughts in terms of how to deliver services at home or at designated places that are considered safe under protective, you know, environments. So their businesses are still, they were not doing it before, they are now doing it and they are making extra income, you know, and so on. That's the kind of thing I would suggest, and I would think that we can do, is to catch in on the gaps, on the needs, and then fill it in the best way we can in order to solve the problems.
All right. Thank you so much, Prof. I know that businesses are in business to make money, but there are some people also who make a killing out of it and probably end up causing others to lose their lives because they can't afford the very, very exorbitant prices. What would be your thought on that in terms of ethical business?
No, you see, what is going to happen? What is happening is you will probably not be able to stop all that. But my advice to our people and to everybody is this is not the time to cut in on opportunities and exploit people.
Yeah. This
time is the time for our global community to fight this common enemy.
Yes.
So if you're in business, if you have the opportunity to fill in a gap, you fill in a gap at a moderate, you know, what it means. I mean, for you people who are in business, you know what it means. You make what you can make to sustain your business and to sustain the next line of supply and to be able to supply the needs of the people. It's not about exploiting people. Of course, we cannot stop all that, but I think that kind of thinking will in itself add to the problem that we are already in. So let's think of solving the problems first, rather than thinking of making profit for ourselves.
Yes, thank you so much for that, because obviously there will be some people providing masks, providing sanitizers, providing ventilators, providing different, you know, products and services, and some might find themselves charging exorbitantly and forgetting what we are trying to do in the process. Yes, you should be making money, but it should be money that brings you fulfillment, that you are actually saving lives.
I agree with you.
Beautiful stuff. Let's go ahead, Prof. I know you have a lot to share with us. Please feel free to share the rest of the information you have for us. And included in the solutions, I also hope you will be able to suggest some policy issues. So for policymakers, you know, sometimes policymakers, when we are in such a time as this, is too much on their hands.
Yeah.
Probably they might need to hear some tips on what should they do on their policies, whether company policies or governmental policies.
Okay. Let me start by saying that let me start from the health sector, and then we can relate it to all other sectors because it's a common problem. One of the things that should be done that will help us to, you know, reduce the effect on all other sectors of the economy is to reduce the number of people that are infected or getting infected with this virus. All right. Now, several policies and several steps have been taken by governments around the world, including institutions and so on, to restrict movements, and to restrict gatherings and to keep people at home. Now, all those are steps in the right direction, but in some of the way we see it being implemented, it is not a holistic approach. And I will speak particularly for our developing countries, and I'm talking about most countries in Africa, sub-Saharan Africa, where you can see evidently, we know our history, we know what's happening there. There are other factors, you know, that probably kill more than coronavirus, and we have been in them, you know, the poverty and diseases, malaria, and so on and so forth, have all been a major problem. And other infectious diseases, HIV, for example, and so on, that have all been ravaging our people in sub-Saharan Africa. So now, what needed, I mean, it is true that we don't seem to have a strategy in place, you know, for managing crises like this in several of our governmental levels. So when they come like this, it is like, you know, it is like you start jumping in the middle of the fire. Where do you put water to put off the fire? You don't even know where to get water from. So that is what's happening. Now, if you want to restrict people, because that's one of the major targets, the major target is to reduce the number of new infections. If we don't do that, the health system will completely break down. And that will be a major disaster. So if we slow down the rate of infection, the health system will have a breathing space to re-strategize, you know, to restock, you know, and so on. So, but the way to do it is to take care of other factors that will help it to be effective. Okay, that has not been done, at least in many countries, or even the way it is being done is, like you said, it's more political. I'm sorry to say, it's more political, and that's not going to help us anywhere. Now, if you lock people in, you must find a way that they will find food to eat. Otherwise, they cannot be locked in. You know, hunger will kill them rather than coronavirus. All right. So what should we have done? We should have planned, because I think this thing for African countries, it came, yeah, it's still not so alarming as it is in the West. So the way it started, we should have thought earlier on and begin to strategize on how to handle quarantine issues the way it is right now. I am seeing clips and videos of some places in Africa where people are literally, you know, fighting over food, or some places where you now see a little supply of food and people are fighting and jumping and harassing and injuring themselves because they've been locked down for so many days. That's not going to solve the problem, because if you say you want social distancing or physical distancing, the people are hungry and they are rushing out because of some small supply of food somewhere. You haven't effected your stay home instructions effectively. They will still spread the virus if anybody has it. Okay, so that's number one thing. That's not been done very well, but I hope that our leaders are thinking. The truth of the matter is that in the middle of this pandemic right now, it needs fast thinking, and it needs, you know, strategic thinking, and it needs a political approach, an approach that has no politics attached to it. We must save lives first, because, before politics. That's what we need to do.
Right.
So that's very important. All right. So because there is no yet cure for it, you know, this is the only public health measures that we think will reduce the infection rate, and trying to stay home, trying to keep distance, and so on and so forth. But it must be done, you know, to ensure that it is effective in terms of strategy. So that is one of the big thing that we should look at. In some countries where we can say that people have been thinking, and not that it's 100%, but they have some kind of a social welfare system, all right, where you have some kind of, resources set aside for times like this. Okay, so, and when there is a time like this, you have something to draw upon in order to cushion the effect within certain, at least for some time, while you plan and think again what to do in case the pandemic, extends beyond such period. I don't know how many countries in Africa we do have that kind of thing in place, but it calls for the thinking of leadership right now, to begin to think into the future for such things, instead of, using money for some of the, well, I'm not saying that people are not trying to be negative, but instead of spending money for things that are not going to help our populace, we should think of investing such money, for times of emergencies like this. The other aspect of the solution that I can think for the health sector is we've talked about the use of technology, and it's quite important, the technology uptake in order to reduce the risk of infecting health workers. And people are beginning to think of, digital consultations and telemedicine, and trying to proffer solution online via telemedicine and digital consultation to people, and reaching out to them with advice and selecting patients that, based on the symptoms and the discussions that you have with them, you can triage, what we call triaging of patients, or selecting patients that may need certain critical attention without necessarily coming in physical contact with them. And I suppose that even in the business cycle for entrepreneurs, we've talked about it, this is also very, very important. For example, you know this more than me, the Amazon person, Jeff Bezos, his own business is not a business that you need to go physically to anybody, but anywhere in the world, Jeff Bezos will reach you with any product. And no wonder he is where he is today. And we should learn that about all other aspects of our businesses. You don't need to travel to the United States. You don't need to travel to anywhere unless it is so necessary. And you can still make money if you are really into business. So the same thing with the health sector, we can do that and try to recoup, or rather reduce the infection rate on our health workers. Very, very important for us to try all those things. And by the way, I think this is very efficient because we are all working. I mean, we are not, for example, we have been locked down, but we have not been locked away from work. We are all working, we are all doing teaching, we are all consulting, and yes, we are all doing everything that we should have been doing, except physical contact. So I think that this is the future of the health sector. This is the future of most businesses, and we need to learn from this global pandemic.
Thank you so much. From what you said, one of the things that I picked, talking of emergencies, remember, as financial wellness consultants, we teach people that everybody must have an emergency fund that can help you in times of emergency, which we call a rainy day fund. So it's showing that it's not just for individuals, it should be also for governments.
Yes.
And I don't know how many governments in Africa have stashed away cash somewhere so that in the middle of an emergency, they can say we are taking such a percentage.
That's a big problem. I don't know, but I don't think that, well, even if there is, maybe the way it's being used or the way it's being strategized is not working well in most of our African countries, if at all there is. But this is something that we must consider at the national levels. Governments must consider this, and it is necessary. Because you see, when we are leaders for the people. Yes. And that's what we need to think of when we are, especially in our developing world, where we have a problem of leadership, because leaders are for themselves, not for the people, I'm sorry to say. I just want to be honest. Many of the leaders are for themselves and not for the people, perhaps not all. And so you can see that it is a problem. So when they get in there, sometimes they don't get in there on the right pedestal. So they get in there and more or less, they don't have a program, you know, they don't have a program. Maybe the understanding of running the economies of nations is not even there. And when they want to pick people, they pick politically, you know, aligned people to themselves, not necessarily people who can give them the correct, you know, developmental advice. So it's a big problem. And our must think of this.
Yeah, that's a sad reality of our continent. So, Prof, what should the leaders be doing right now? Should leaders be sleeping right now and resting until COVID-19 is gone? Because I've seen on social media quite a lot of people, because I believe all of us are leaders, right?
Yes.
All of us are leaders. We lead ourselves. There is personal leadership. Then we also lead in our families. We lead in our communities. We lead in our companies. We lead in our government departments. Some lead at national level and so on. Everybody's a leader. But I see quite a lot of people, probably mostly on social media, saying, oh, I'm tired of sleeping and stuff like that. I'm thinking, okay, I'm not here to judge. Who am I? But do you think people should be sleeping this time?
Well, I don't think that anybody who has any form of leadership responsibility, whether it is in the home, like you have said, or even in your office anywhere, I don't think that we should be sleeping really over this challenge. The truth of the matter is that periods like this are periods that places a demand on leaders to think.
Yes.
Okay, so we must invest a lot of time in thinking and in planning. All right, and maybe when we say people should not, we're not saying that, well, you cannot sleep in the night. No, we are talking about being irresponsible here. All right. So the truth of the matter is that our minds and everything that we have must be engaged in critical thinking, in critical planning, and in critical strategizing. And like we said before, we must look outside of the box. You see, in our developing world, we always think of a solution from outside.
Right.
So we almost always think that, well, the West will have some solution for our challenges. And for years, we have become, you know, more or less dependent on assistance and on grants and on development partners and so on. Are all these not important? I'm not saying they are not important, but right now, every country, every sector of the economy in the world, even the rich, is struggling with this disaster. So what do? It's time for strategizing. It's time for thinking forward. In the middle of this one now, we must think short term and we must think long term. The short term measures are what some of the things that we have outlined before. We have to fight to cope with the spread of the virus, reduce its infectivity, reduce the burden, and try to allow the health system to recover. The long term is after COVID-19, because God will help us. We'll get out of it. So after COVID-19, the devastating effect of this pandemic will have a toll on all our economic lives. Then where do we go from there? Right. That's why we must not be sleeping. We must be thinking. If you were depending on a development partner to fund critical sectors of some of the things in your economy before, don't expect the same kind of thing to happen, because there is now a problem with the flow of the cash or the money from any country. There will be certainly be readjustment. There will certainly be, you know, rechanneling, and there will be certainly be cuts, if not complete stop. I mean, I'm just thinking, this is what I have been thinking of and trying to say, okay, if you are a kind of person who is funded by some of these agencies, you must start thinking. And it begins again with leadership from our governments, from our head of institutions, in order to maintain such critical services or such critical things that were being funded, at least not for them to close down completely. What are we going to do? So that's what we need to be thinking about and not to be sleeping. All right, so that is what I think we must do. The other thing is, right now, in the middle of this crisis, for the health sector, and I think also for other sectors, we must now, as leaders, begin to realistically reassess our health systems so that we can identify the weaknesses, the strengths, the opportunities, and the threats that we have when we are faced with a challenge like this, in order to help us come up with an evidence-based, solution.
I like that, Prof. I like that, evidence-based solution.
Yeah, because that is, you see, that is what is our problem in I'm sorry to say, in Africa. Yes. Many of the things that we do, even at government level, do not have evidence.
All right.
Okay, they are politically motivated without any scientific basis to prove. And therefore, we sink in even the little money that should have been used on an evidence-based platform and put it, and we can say the money has gone down the drain. Okay, so that is how to build a sustainable future of anything. It must be evidence-based, at least at the current level, and then you keep on researching, because nobody, the system of the world is not sitting down in one place. As you can see, even diseases are emerging. Coronavirus is some kind of virus that we used to know coronavirus before, but the strength and the type that we used to know never caused this problem. But this one just came from nowhere, and look at the way it's ravaging our economy because we are probably not anticipating it. So we need to do that. We have evidence-based, and after that, we then use the data in order to restructure our health system. We need to invest money into health systems research. Okay, and as I'm talking like this, I think that for business people and other people in other sectors of the economy, you can also think of the different aspects in those economies, in those sectors of the economy. My thinking is that we need to invest into more research into health systems and health system structures. Okay, so that is what we need to do. We come up with an evidence-based, kind of generate a data that we can use in order to build the solution for the future when we are faced with things like this. That is not something that I see so much done in our developing world, and that is what we need to do as leaders.
Thank you so much. So you have already touched on the research there, the importance of research. I'm not sure whether it's true, Prof. I once heard that the amount of research that Africa generates is very pathetic. We generate less than 1% of world research. Is that true?
Yeah, well, I think it's true if you look at it. Because when we are talking of research, yeah, anything can be called research, all right? But we are talking about a research that, changes the way we live, research that informed about strategies and political shift, research that will cause a paradigm change in anything we do. So we're trying to say that a research that will have an impact.
Right.
All right, but in most of our, how many people have, licensed products from their own research in Africa that has informed changes in the health sector, that has informed changes in education, and so on and so forth? They could be there, but they don't count so much on the global scale.
Yes.
That's why the statistics is suggesting like that, and I don't think that it is far from the truth. So the kind of yeah. So the kind of
and that's for me it's very painful. That's very pathetic. We have a lot of smart people in Africa, in the developing world. I think one of our challenges also is funding, because when you start talking of impact research, that's very demanding. And in most cases, it takes a lot of time and it needs money. When you look at China, they have not just a reason to where they are now to become a threat of becoming a superpower in the whole world. It didn't just happen by chance. Remember, China used to be a developing country.
Exactly.
They have put a lot of money into
not so long ago,
research.
actually.
Yeah, they put a lot of money into research. So I think this speaks to leaders at all levels to say money, enough money must be channeled into research.
Yes.
Even at individual level, sometimes when you're talking to potential entrepreneurs, you tell them you have to research about the market first. They are not happy with that. You're wasting my time. You tell me to go and research. While I'm researching, others are already making money. You want to go and try and make money when you haven't done research. You don't even know the needs of your customers. Exactly. So it begins with individuals. People generally don't like research. Everywhere I've ever given a speech, I ask this question: how many of you love research? Even when you talk to master's classes, Prof, you know it. If you PhD classes have no choice, because PhD is research. But otherwise, generally, people don't like research.
Yeah. Now, you see, the problem is, and again, that is the mindset. Many of us in Africa think of business in terms of just money.
Yes.
Okay. I'm not saying that business doesn't have to do with money, but you see, we are talking about sustainable. If you want money, we are talking about sustainability, what we call economic sustainability, money that is sustainable, not one snapshot kind of making profit and then in the next 1 year, 2 years or so, you are bankrupt, you are running around the street again looking for another one opportunity. No. So investment in research, in order for you to have the facts that will bring you sustainable business, is far more important than the run to make the cash at the moment.
Right.
I'll tell you an example, and you have raised that a very, very important issue. Let me cite the example of the United States of America. You've heard of, and of course in the United Kingdom and so on, you've heard of the National Health Institutes. You've heard of all these health institutes that are actually research institutes. Now, every year, billions, I'm talking about tens of billions of dollars, are allocated from the government for researching on health issues in the National Health Institute alone, apart from the others like National Cancer Institute and so on and so forth. Okay, so that is a lifetime investment. What our African nations should do is to emulate something similar. We have relegated research to no place of importance. I don't know how many research institutes, real research institutes we have across our nations in Africa. Even if you have their buildings, there's no investment into them. So, and our brilliant minds and our researchers in Africa, some of the best that we actually have, do not have any funding from the government to do what they ought to do in our environment. You need now to look for money from America or from the West to do a research in Africa. And apart from being, politically correct, to be honest with you, whoever pays they said whoever pays the piper dictate the tune of the dance. Is that if I'm correct? If I'm saying that correctly? So many people who will give you money to do research will do the research for their interests and so on and so forth. But our professors, our intellectuals, our institutes of research, government must invest money into our own people, into our own research institute in order for us to be able to carry out our research relevant to our people. Of course, we are not saying that we shouldn't collaborate. The world is a global village. We should collaborate, but we should have a significant say and significant contribution into researching into health of our people. Now, this applies to all other sectors of whether it is in education, whether it is in business, whether it is in agriculture. This needs to be. I mean, some of the monies that are being spent, on things that really don't matter to the life of the people can go into investment into research. We are not saying that you carry the whole national budget and put it into research, but you can have a percentage. If every year you just put this percentage, usefully and wisely into this fund, something will be going on to make some impact. I think that is something that is very important. And maybe before I leave that area, let me talk about the possible thing that will happen after COVID-19. And that is where I think our leaders should start thinking in that direction. After COVID-19, because of what we have faced in this pandemic, it's being realized now that investment into prevention and other non-medical methods, can cost us much more money than the billions and trillions of dollars that we're using now to fight this current pandemic. Okay, so it is likely for leaders of thought, I mean to say, that there will be some significant investment, even perhaps on the African continent, into research in global health and development, into research in investing in production of medical equipment, pharmaceuticals, and drugs on the continent of Africa. I hope so. That's my own thinking. I hope so. Now, you don't need every country. If there's what you call I think there's something they call African Union, I believe. Now, we need to act as a continent. This is a global war. This is a global approach. We need to act, together. We need to think together. We need to work together. On that platform, I see and I hope that there will be investment in today's, industries, beginning with research and setting up these industries to meet the production of critical medical equipment that this pandemic has taught us now. Okay, so that we don't depend again on an importation from United States or from other countries in the world in the face of a pandemic like this. What do you do? When you have those things, you don't have to have all of them in one country if there is truly a spirit of an African Union. You can have one functional industry producing face masks somewhere. You can have one producing ventilators in another place, in the regions, the sub-regions of Africa. And we can work in that spirit. So when we have a need on the continent, we can ramp up the production of these things within the continent to meet the need of our health sector. And that will create a lot of business and employment opportunities for our people locally. This is likely going to happen because funding of several things will change direction after this global pandemic of coronavirus, hopefully. And I hope that people are thinking along that line as well.
Thank you so much, Prof. Thank you very much. In other words, what I'm picking from what you're saying is that prevention is always cheaper than cure. And it's easier to deal with than cure. It is
always cheaper than cure, because if half of the money or even just 1/3 of the money that is being spent on the current pandemic is invested into preventive measures, we will be ready to face global pandemics like this next time. I'm not saying we will stop them. We will not stop them, but we will reduce the millions of lives lost, the millions of dollars or trillions of dollars lost, and so on and so forth. Livelihoods and so on.
And still on research, Prof. I think one other thing is that our leaders, probably at national level in Africa, need to sensitize the nations on the importance of research. Because you find that generally to do research in Africa is very hard. You and I are researchers and you know what I'm talking about. To get the necessary permits for you to go around doing the research, to just talk to people, to fill in a questionnaire, To have 100 questionnaires completed, you know, each time a questionnaire is completed, it's like you have mined gold. You get so excited, one questionnaire has been completed. But in the developed world, it's much easier. And I think we need people to be sensitized to the importance of research, because with the research, it will actually help us to develop faster and prevent certain problems.
Yeah, well, the awareness part is necessary. But you see, the point is when a leader has a vision, all right, from a leadership position, he will develop the desire to sensitize people to go in the direction of that vision. So indeed, if we make governments or leadership look like the people, we are there in leadership just because we need to give people to pay salaries and to give people food and so on and so forth. Nobody will think that research is important. Now, these are all important, but the truth of the matter is, as leaders, we also must have a flair that research will help us to help our people.
Right.
And that way, it will be part of our development programs. Whatever program you have, if you are a politician and you are in leadership position, you know, that will be part of your manifesto, if I want to put it, and people will hold you accountable for the delivery of that. Now, the second thing that we have to do is to empower our institutions, our educational institutions, our research institutions, and place a demand on them in terms of research. Because it's not easy to do research, but we have to structure it in such a way that people will have a desire to do it.
Right.
Okay? Otherwise, you cannot put people to do research when you haven't provided the enabling environment and the enabling infrastructure to do the research. Research is not, I mean, we are saying that we're talking about research that will bring some impact on the economy and the lives of our people. So it is not about, you know, roadside, something you do, I mean, in order for you to get promotion, as it is the culture in most of our places in Africa, because research are just to put down statistics so that they can count it and you get promotion if you are wherever you are, and so on and so forth. That's not what we're talking about. So there has to be a structure in place, okay, well structured, and it has to be motivating enough, and there has to be, you know, opportunities given for people to do that. One of the things you can do is that if you say you have invested fund into research and it's available and people can access it in terms of, you know, on competitive basis and in terms of quality of things and all that, people will sit up because the funds are there. All right. So the funds are there, and if you do well, you will be able to do the research that you want to do, and then for our health sectors, ministries of health, you see, we then need to come up with what we call, I believe that most of our countries in Africa have it, but they will probably just be on paper, what we call in some countries, I think they call it the National Health Research Agenda or the National Health Priorities, you know, and so on and so forth. So you put all these things together so that people can be researching, investing the money in researching into priority areas of health of our people, including infectious diseases like this one. That's the way to go about it. That's the way to go about it. And I give you an example. I'm sorry, I'll give you an example. For example, for us here, our university is the first of its kind in this part of the world. I mean, there has never been an English medium university here, and so on and so forth. And I can say it's the top national university right now. We're relatively well funded. And you can see what they are doing seems to be in the right direction. You know, research is so much emphasized here that every year the university allocates, you know, hundreds of thousands of dollars, you know, every year. This is not, we're not talking about once, you know, if not millions of dollars. This is one university. And it is quite competitive, and there is the money there for you to do research at any level. Whether you are a lecturer or you are a professor, you can access funds, but you must work hard, okay? And no wonder, I mean, in just 10 years, the university has produced some of the things that are used here locally and people have, you know, even developed things within the university, manufacture things within the university. This is what we are talking about. So when you give it 20 years, you give it 30 years down the line, you will discover that the result of the research that was invested in is benefiting the nation. That's what we're saying.
I'm seeing the benefits of interviewing a medical doctor who is a professor, who is a man of God at the same time. There are so many things coming together there. So you have talked about research, Prof. What about consultancy? How should consultancy be properly structured in a university? Because I think, imagine with the number of universities and colleges that we have in Africa, if each one of them had their lecturers doing proper consulting, consulting also involves research, isn't it?
Yes.
These people would actually bring a lot of solutions, even for the entrepreneurs in the country.
Well, let me again say, maybe use an example from our university here. You know, everything I'm telling you does not end within the walls of the university. Okay, there are different funding schemes, and most of the research that is being emphasized has to do with, you know, link with industries. Okay,
I like that.
Yeah, so there is even a stream that focuses only on people who are interested in researching in order to, you know, get out products into the market, and they have to link with industry, leaders of industry, for consultancies from these people in order to inform the direction of their research.
Right.
This is what is happening in the industry, so that your research is not only an academic exercise, but it's a relevant research. So we have several consultancy channels here from the different sectors of the economy and leaders of industry. We have those that have to do with clinical trials, and they are working with pharmaceutical industries. We have those that have to do with business. I mean, our School of Business, our, you know, Graduate School of Business here is really involved with a lot of businesses, not only in this country, but in Central Asia and even in Europe, and so on and so forth. So a lot of consultancies, a lot of collaborations, a lot of input from the industry in terms of what is happening in the market of this product that you want to research on is being discussed together, so that you can have what is a profitable research to benefit the industry, and the industry benefit benefiting the academia. That's what we're doing.
Awesome, awesome. Prof, I wanted us to, I don't know what else you still have for us, but at the end, I would like you to talk about, as a man of God, how do you see this situation, and what would you say to children of God out there? Many people are afraid. Many people have lost their jobs. Some have lost their relatives. Some are sick right now from COVID-19 or from other diseases, and they are now being neglected and things like that. But before you go there, I wanted you to give me your opinion. I'm not saying it's an expert opinion, but as an individual. Africans in particular, they are talking about the issue of the vaccine. They are saying this vaccine, nobody should take it. If there is a vaccine that is found, don't take it. Some are even saying refuse to be tested for coronavirus because you will be put something for 666. Or maybe there's someone somewhere who is seated, who is trying to wipe away the black race. So the moment they say you are being tested for coronavirus, you are finished, you get the coronavirus. If there is a vaccine that is found somewhere, if you take that vaccine, forget about the world, yeah, or it's over. And then we also have some people who are not thinking, who are not preparing for the future, because they are saying we are just waiting for the coming of Jesus. This coronavirus, Jesus is just very close.
Well, let me say that in a pandemic like this, speaking naturally, there is definitely bound to be fears, and people who being led by the whims and the caprices of society will definitely have lots of fears and, you know, uncertainties. And there is a lot of news about, you know, what you have just said. And I've even read about 5G and, you know, all manner of things. Okay. Now, that is something that, in my personal opinion, should not instill fear into us as children of God. As for the part of the vaccine, if at all a vaccine is developed, I think that the vaccine will undergo testing and people will know what is there. And we don't know how, for those who believe in the Bible, for those of us who believe in God, we know the science, we know what these 666 things is going to be like. The time, we don't know. But I think that we are informed enough, and if we are with God, I don't see how it will just take over the whole world and everybody will be subjected to take the vaccine, if indeed is what people are saying. I'm not saying it is, because I haven't seen the vaccine myself. I haven't seen the chips they are talking about, and there's so much talk, and a lot of it is instilling fear into people. All right, but I know that this is something that we just have to turn to God and trust God that there is a promise for us from God, and if we are with God, there is always an exemption for us, whatever it is. It could be signs of the end world, of the end of the world. It could be anything. Jesus already told us, and we are not taken by surprise by anything at all, to be honest. If we know God. So for the vaccine, I don't think that I can say no, don't take, or no, take, because I don't have sufficient information at the moment to say that it will give you 666 or no 666. No. We trust God for every solution that will come, and we will pray to God for the wisdom of God, you know, for us to know what it is and what it is not. For the aspect, I think the other question you were talking about is, if you could just remind me, apart from the vaccine, you mentioned something else that is quite important.
Okay, I mentioned the vaccine, and I was saying also we need encouragement from you for children of God out there who are afraid and things like that.
No, I mean, my advice for every child of God, I don't know, if you're truly a child of God, to be honest, this is not a time for you to fear. I don't see.
And what do you say to those who are not children of God?
Well, to those who are not children of God, and to the whole world, actually,
yes.
You can see that just one small virus, I'm sorry to say, just one virus, something you cannot even see,
yes,
has virtually crippled the entire world. Even the most strong, even the most arrogant, even the one that says there is no God is lost. They don't even know what they're doing right now. So I'm trying to say here, it doesn't matter what you think you are, a country, a president, a nation, whatever you think of God that has been in a negative has just proven to you within a very short time that there can be nothing but God. I mean, prime ministers of countries and leaders of countries have started talking that we only need God. I mean, yes, these are people who ordinarily wouldn't have said so. Okay, but they're saying we only need God. So the truth of the matter is there is no true solution to this problem from any human angle if God does not help us. That's what I can give the assurance of to anybody who cares to hear. If God does not help us out of this pandemic, there is no country, there is no economy anywhere that can solve this problem. Now, before now, the mighty, the wealthy, they could run anywhere because they have money and seek for health anywhere, and they can take care of their health. So can you tell me, even with your money, where are you going to now? Where can you go? Nowhere. So this again goes back to our leaders of thought in Africa. Okay, so this coronavirus pandemic is a stimulus for us to begin to look inward, and in the fear of God, begin to invest in our infrastructural development of the different sectors of our economy. Can a president be sick somewhere in African country now and you say you want to go for looking for healthcare in Canada, in the United States now? No, you go and collect coronavirus. You go and collect coronavirus. So we need to fear God. We need to turn to God to help us. We have a promise from God, which if we do as he says, it's a covenant and we will get out of it. Okay. If we can turn to him in repentance and seek his face, he says he will heal our land, and he will restore us. This is the time for those who fear God to turn to God in prayers. For those who don't know God, my message to you is there is no way out. There is no way out because there's no other God. There's no other solution. God is the solution to this problem right now, no matter our efforts. That's what I can say.
They need to receive Jesus as their personal savior.
They need Jesus because Jesus is the solution here. Jesus is the solution here. They need to acknowledge Jesus. They need to receive Jesus. They need to believe in Jesus.
Yes.
There will be a turn for the better for the world.
Thank you so much, Prof. Is there something else you would want to share with us? I was thinking that after you give us your roundup, I would like to appreciate Sekai Kabe and Teddy. They joined us for this meeting. We really appreciate you guys. If you have any questions, please begin to send some chats so that Prof can respond to them. So as Prof is finishing off, Teddy and Sekai, if you can please send some chats if you have questions or comments. Prof, you can go ahead.
Yeah, well, I think what I can say again is to just re-emphasize what our leaders can do as individuals, as leaders of nations, as leaders of institutions. We should face the reality of what we have now in truth and in sincerity of heart. Let us avoid playing politics, all right? Let us avoid finger pointing. Let us put ourselves together. Let's work together. In my place, there is a saying that if your house is on fire, you don't go around pursuing rats in the bush. All right, so for African leaders and for our leaders everywhere, this is the time for us to think inward and think out of the box and re-strategize and think well for our people and avoid politics. And for individuals, it is time for us, again, to see what we can do on our personal levels, in our relationship with God, in our contribution to our societies, and in what we can do to benefit the lot of humanity. That's what we can do.
Thank you very much, Prof. And thank you, Teddy. I saw Teddy posting there that he is very grateful. Everything was very clear, so he doesn't have any questions. Teddy, we really appreciate your time and the Lord bless you. Prof, once again, thank you so much. Yes, Sekai Kabe is saying thank you very much. Thank you, Sekai. We appreciate your coming to this show. We really, really appreciate it.
Thank you, Sekai and Teddy. Nice to see those names again from Botswana.
Yes, definitely, definitely. Prof, thank you so much for your time. May the Lord bless you.
Thank you very much. It was a privilege, and we keep in touch, and may God bless us and help us out of this pandemic. Thank you.
Thank you very much.
Yes.
Bye for now.